Dr. Thomas, welcome back to our conversations regarding mental health and mental health awareness. Today, a question that I have is, can you share with us briefly some of the most common mental health illnesses?
Thank you, Viju. I will try my best to be as brief as possible. One of the common problem is depression. Depression, as we know, is a killer for many people. People who have temporary depression, for example, we failed in an exam, so we feel depressed. And usually that type of depressions go away within a short time. But that also can lead to a lot of problems. And then there are depressions associated with the mental illnesses. And that type of problems need the help from experienced counselors, psychiatrists, and psychologists. And one other common problem which we see in the society is bipolar disorder. That means they have a lot of mood swing. In the morning, they have one mood. Evening, they may have different mood. Or one day, husband will see the wife in a good mood when she go to work. And maybe by evening, next day, after 2 days, she is totally a different person. There are mood swings. There are two poles in the world, North Pole and South Pole. These are different. One is on one side, another is on another side. So bipolar disease need treatment. And we will, in the coming sessions, as we go further, we can discuss about these things in detail. Then another common disease which we see around is schizophrenia. I know you may have seen people talking to themselves, or they will say, I hear somebody talking to me. And that type of people also need treatment. Effective treatments are available. Another problem is borderline personality disorder, which is very harmful to themselves and other people, but very hard to diagnose, and very little medicine is available except for symptoms. I have written a book about that subject. And then there are several other diseases which need attention. And list can go pages. But these are some of the common problems. And in addition to what I said, many people who have bipolar or even depression or other diseases have anger issues. But that doesn't mean if somebody has anger issue, has mental problem. Why I make that very clear, that anger can happen in various stages of our life. The same with the depression. It can be very temporary. It can be long-lasting also.
So my follow-up question is, if we know of people who have some mental health illness, or if we ourselves experience some of these illnesses, what are some helpful things we can do?
Well, that's a very, very important question. I'll give you one or two examples. I usually tell the parents when I take the classes for families in schools and other places, if you see any behavioral changes in the children, some children show the symptoms very early in their life, maybe during their high school years. I'll give one example. I told you about schizophrenia. Usually the children show the symptom when they are 8, 9, 10, 11, 12. It can be later also. So there is no cut and right rule. They have to show the symptom by 8. No. That is only an idea that when they show symptoms such as lack of interest in studies, no matter how much you struggle, they are not improving in their studies. The best thing to do is take them to an experienced counselor, psychologist, or a psychiatrist. They can further help that person. Any behavioral problem, for example, bipolar, anger, beating the parents, getting angry and upset with the neighbors. If the symptoms continue for a few weeks, please don't ignore. Take them to a professional. We can pray for them. We can guide them. We can encourage them. Prayer is very important because religious people like to spend a lot of time in prayer finding answers. I'm not against prayer. I appreciate and I value the prayer. But for such people, nowadays, treatment is available. And the most important thing is, please don't look down upon them. They have a problem and deal with it. Love them and care for them. If we care for them, we will give them the maximum help they require. So the society, religious institutions, schools, parents, brothers and sisters must be willing to help such people who are struggling with mental illnesses, problem, or disabilities.
Thank you, Dr. Thomas, for your time. We will see you at the next conversation.
Thank you, Viju.